Viroqua. Could you starting, Jorge?
Okay. We need to check.
Your color was good on that one. It wasn't as dark.
Oh my God. I don't know what happened now.
Did you open in Chrome?
Sí, pero now I don't know where is Viroqua. Viroqua. A ver, ¿a alguien le gusta Viroqua? No. I'm sorry.
And also, for a while, Pastor Erica will connect with her churches. You are invited to connect by this coming Sunday. At 9:45, we will start to gathering and having an informal conversation. And at 10 a.m., we will start our service.
Okay. Hi, hello, welcome. Welcome to everybody. Wesley and Viroqua United Methodist Church. They are also Dell, Faith, and Lafarge United Methodist Church. So welcome to everybody that we are here together as we promised to you to be with this session of questions and answers. And many of you already know, and I would like to introduce to Dr. Elizabeth Roberts. She is doctor in the Vernon Memorial Hospital, and she works in the hospital, and she also works in the clinic. And to us, it's a big bless and a privilege to having to be here today with you, Elizabeth, doctor. She's member of Viroqua United Methodist Church. So thank you for being here with us today and tonight, and to try to talk, to explain, and to bring a little calm to our hearts and to our life in the middle of this big chaotic situation we are in now. So thank you, Elizabeth.
Yeah.
For being here.
Thanks for having me. I should maybe just say I'm not here officially from Vernon Memorial, so this is just me doing it. I don't have any official representation. And also maybe more to say that I've been busy there getting our response ready, so some of you out there in the internet land may have had more time to surf the internet than I have in the last week or so. So you may actually have better answers than I do, but I'll give you the best ones that I know.
Thank you. And also, Pastor Jorge is here, and I am Pastor Erica Martinez. So, thank you. So, there is many questions that we actually already have it for you, and we hope to have the time. But also, I invite you, if somebody of you would like to send your question, you are welcome to do it. Elizabeth will try to answer us. So feel free to ask to us. So there is many questions we have today. So the first question is, will COVID-19's virulence change as outdoor temps increase?
Yeah, so you're lucky. I actually just did read an article about this. You guys may know that the influenza virus does live better in cold situations, which is why we have flu season. But unfortunately, my understanding is that COVID virus is not actually temperature dependent. So I think there's been myths out there about whether if you live in a warm or humid place, if you have less risk of getting COVID. It doesn't look like that's true, so that's a myth out there, and unfortunately our spring weather coming I don't think is really gonna slow or change the potential for outbreak.
The second question, Doctor, first of all, one more time, thank you, Dr. Elizabeth, for this conversation.
Absolutely.
I have other question. If you get the virus and recover, are you then immune? Can you go out into the world and not worry about getting it again? And if the virus returns next year, will you still be immune?
All right. Well, so here's what I know about that, and this is just in us trying to figure out our own healthcare staffing at Vernon Memorial. So my understanding is that once you get the virus, you do have some level of immunity. We talk about our healthcare workers, once we've been exposed or have it, then that's actually kind of a blessing because we can return to care once we've recovered to take care of people who have had it. But that said, I don't think anybody really knows how long that immunity lasts, and like a lot of viruses, things change very quickly. So part of the question asking if the virus returns next year, are you still going to be immune? I don't think anybody knows. I think in terms of our healthcare conversations that we've had, we've talked about like a 6-month period, but I really don't even know what that's based on exactly because, again, we haven't been that far out from the start of it, right? So yes, it looks like you can show some immunity to it and be around other people who are sick and be protected in that way. But for how long, I think it's anybody's guess at this point.
Thank you.
Yeah.
So, what should to do it? I mean, I know this is pretty new and there is many answers, many questions in the air. So the recommendation is somebody recover about the virus, still be in quarantine, or
No, I think once you've recovered, you don't have to be in quarantine. Like I said, I think as we've been talking about our healthcare staff, if we get sick and recover, then we can actually go back to work and care for people. So, we just have to wait it out, I guess.
okay,
Yeah.
okay.
Your turn.
What do you think about the homemade masks people are sewing? How effective are they? I think it's a good question.
Yeah, I mean, I think, Vernon Memorial at least officially asked people to make masks. Right now, unofficially, we're not having a personal protective equipment shortage, but we also obviously haven't had a run on that stuff either, and we need to be cognizant of how much we have and how much we may go through. So I like that people are willing to sew things because it may be very helpful to us. That said, at least my understanding of what we are asking for and can use is actually a cloth thing that goes over the N95 type mask, and it just allows it to be reused in a different way. One of the things we're kind of clamoring for at work is making sure that we have the proper technique of donning and doffing these because it's really easy to mess it up. And in fact, then having two things, the original mask and then the cloth thing that goes over it, is that much more potential to end up infecting because you have those two different surfaces that need to be really, you have to be careful with it so that you don't recontaminate yourself. The process, I guess, of taking the mask off is actually the most kind of dangerous thing you're doing in the process of that, because that's typically where people mess up that whole process. So yes, I think the cloth masks are good and it can help us extend what we have. But my understanding is it's not just that, not looking to just wear a cloth mask, it goes over an N95 mask. So yeah, I appreciate the people who are sewing those, and I guess, in the best case scenario, let's, pray that we don't have to use them. So don't feel bad. I guess I would love it if we didn't have to use them. But I'd rather, way be prepared, and if we do need them, great. So
I know you have this answer, but which one could be the best fabric to do it?
Oh, so I know there's specific patterns that are out there right now that have very specific instructions and probably say specifically what fabric. I think it's just a cotton that people are using, because I've even seen some people repurposing dish towels. And again, it's not that you're gonna wear this cloth mask on your own and walk out in the community and think that it's giving you some protection from getting COVID. I don't think that's the purpose of what is what we're asking for in healthcare. But if you want specifics, at least with Vernon Memorial and pretty much any other hospital, they've kind of really specifically said this is the pattern we want, and then you just want to follow those instructions to the letter. Okay. Yeah.
Doctor, I want to a little more because one question is related with face masks.
Oh, sure.
My understanding this question is for a person that wanted to ask for a people who are not doctors, people who are on the streets. In fact, yesterday, when I remember that I saw at one of the big stores here in Viroqua, maybe a couple of persons having a face masks.
Yeah.
Face masks. I want to ask this question. I have heard that the use of face masks are not useful, but also that is a way to avoid touching the face. So, okay, I understand this question. Okay, if it's a way to avoid touching the face using a face mask. So, in conclusion, the use of face masks are recommended or not?
So I think for the general public, if you're just out in the world, I don't know if there's been documented evidence that that's protecting you from anything. If you have known direct contact with a person who is COVID positive, then obviously, yes, having a face mask on and wearing all the proper protective equipment, right? I mean, at that point, you need eye protection, you need gloves, you need a gown. And the hard thing is you just don't know who is infected, and you can, be someone who's spreading and sharing the virus without knowing it. So are we all going to walk around in the world with the same stuff that the people are wearing in the emergency rooms or hospitals taking care of COVID positive patients? No. But I mean, I guess it depends on what your what your purpose is and how comfortable you are. But I think, unfortunately, I don't know that just the mask in our day-to-day interactions is going to be enough. And like I said, there's also the potential where actually, you might have that perception that it's keeping you from touching your face. I would probably beg to differ every time I've ever worn a mask. But I'm somebody who I'm constantly touching my face anyway. But those things itch, they're hot, they're sweaty. As soon as you put on a mask, I bet you're not touching your face any less. So I don't know, that's just my personal take on that. But do I think you should go out and wear masks around the community? No. I mean, we're trying here to be 6 feet. I think you're way better off thinking about how much you're washing your hands and trying to keep your social distancing than putting on a mask and thinking. I think that probably gives you more of a false sense of security. That would be my take on that, I think. Yeah.
Another question. Are there any cases of COVID-19 in Vernon County? And I would like to ask another question. When we should to go to the hospital?
Yeah.
In what moment is we should to say, yes, I need to go and to make me the COVID test?
Right. So the official answer on the ARB cases of COVID-19 in Vernon County, no, not since I left the hospital an hour or so ago have I heard of anything official. There's a few tests pending. That said, many of us in healthcare think that the virus is already in our community, but we don't have any official test to prove that, so there's no official case. The really hard thing with that is we can't test everybody, right? So there's these tiers of testing, tier 1, 2, tier 2, 2, 3, and 4. And so there's, anybody who's really sick in the hospital with fever and unknown or unexplained respiratory symptoms, healthcare workers that are sick, people over the age of 60 or that have, we'd say, comorbidities. The unfancy way of saying that is other illnesses that put them at risk. So they have lung disease or heart disease or diabetes, or they're pregnant, or they're immunocompromised. Those people, if they have symptoms right now, can be tested, but pretty much we're not testing anybody else. So I think the numbers of reporting that you see are behind our actual situation. The reason at this point for not testing much in Wisconsin is still a supply issue. So we only have a certain number of swabs, and then there's a limited amount of ability to process all those through a lab. So hence the tiered system. And then your question about when to go to the hospital. I mean, if you have a fever and respiratory symptoms, or I would also maybe make the caveat if you have gastrointestinal symptoms and a fever, some people are presenting for COVID with gastrointestinal symptoms and not the initial like cough and shortness of breath and fever that we've thought of. A lot of the people who have those things though don't need to be in the hospital. Like they can actually be told to shelter at home and wait it out for the 14 days. But if you're really getting short of breath and have things that you can't manage safely at home, then obviously you need to come in. So Memorial has a respiratory clinic set up, and if you've been around town, you might see that on the east side of our building there's a red tent, there's a special parking area. There's also a hotline, and man, I should have written down the number. If you look on the website, I'm going to say it wrong if I spit it out right now, but there's a hotline number that you can call, and the nurses are getting really good at triaging. There's a whole triage process of questions to figure out who needs to come in, do you qualify for testing, and so a lot of that is, and that said, like over the past week and a half, that changes honestly like every day and sometimes every couple days. I think we've had the longest kind of period of not changing the criteria for all this, probably just in yesterday and today. Otherwise, it would be like every day you come to work and like it would be a different set of like criteria for who you could test and who you couldn't. And initially, we were able to test more people, or we had more people coming because they had some, exposure or travel or reason to think that they might need to be tested. So it makes it interesting because if you're looking for a disease that can be, expressed in such variable ways, a lot of us who could have mild cases of it, we're never going to know, right? Because we're not doing testing on those people. So eventually, I'm sure we will have a positive any day now in our community, and maybe that will come from somebody who's sicker than the rest of us who could have it. So I don't know if that helps, but
no, I think so. It helps a lot. I will try to look for the information that you say about the
hotline,
yeah, and to inform the people
that would be
who is already watching us.
Doctor, I want to ask you two questions. In fact, two questions that I have in my people are asking. I will use just one question, but for now, Angie Howley Macaulay is asking, is a fever a necessary part of the diagnosis, or could someone present without one?
I think it is possible to not have a fever, but I think a high percentage of people at some point during the course of their sickness have fever. Are you going to absolutely have a fever when you present to medical care? Not necessarily. There's a lower percentage of people. I mean, most people, yes, have a fever and cough symptoms, but there is a small cohort of those people who present really short of breath, who don't have fever at the time that they show up to the medical facility, if that makes sense. But probably at some point during the course of having COVID, I think pretty much everybody does have a fever.
Oh, okay. Doctor, the second question is, I will try to show you two questions. I guess both questions are more for the end of this conversation, but we have not ordered a specific order. I want to join two questions. How long do you think it will be before we experience the brunt of the disease in this area? And second, in the other hand, I believe that many people is asking the same, including me, including the most of people. When do you consider? I know you have not a magic ball. No, I know, we know. But when do you consider that we will be able to return to normal life, where we can already have churches?
Yeah, they're great questions, and I think we all have them. Well, I don't think it's by Easter. I think our president is wanting to help our economy along and hoping that we'll get back to normal sooner than what my gestalt is for how this happens. I mean, the whole point of physically distancing each other, right, is to change that curve. So if we do this really well, it's actually supposed to take longer, right? Because if we do this poorly and our cases shoot up and we overwhelm our healthcare system, we'll get it over with quickly, but we'll get it over with quickly by doing a really bad job of it and having a lot of people die. Whereas if we stay away from each other, then we still may have the same number of cases, right? But they get stretched out over a longer period of time. So I don't have a for sure answer, but I guess I kind of feel like it's going to be months.
No.
I don't know, especially, right, and some of that's going to depend, I think, on who gets to make those decisions, if that makes sense. Like, is it our politicians that are going to tell us when we can go back to being social with each other? Is it the World Health Organization? Is it CDC? Are those people actually going to all talk to each other and make good informed decisions? Are we basing it on economics? Are we basing it on numbers of deaths? Are we basing it on the fact that we're just really tired of sitting in our houses by ourselves? I don't know, right? So it's a loaded question of when, when is it truly safe? I think, if we did it right, it would be a long time, and it's probably not the answer you want to hear.
Thank you.
The next question is obviously, all these questions is about our concerns and our fears and everything. But is the Inverno Memorial Hospital equipped to handle cases of COVID-19?
Yeah, well, so I can tell you, I mean, that's what I have been busy trying to figure out. So our hospital, we, of course, everything has gotten turned on its head in the last week or two that we've been doing this. And we've, like I said, a respiratory clinic that's really meant to treat and find the COVID virus and keep that kind of contained separately from what we're trying to do with just generally taking care of everybody, and do that in a way that can best stratify and lower our risk of contaminating each other. So my role and how our hospital is prepared, I'm on the team of let's make sure that we can take care of all of our patients. So our outpatient clinics and our chronic care And that looks really different right now. If you do need to go to the doctor, at this point, we're still really trying to keep people at home. So as much as we can do things on the phone, if it's managing your diabetes over the phone or whatever, if there's something that we really truly have to see or listen to or feel or touch or whatever, then obviously then maybe the benefit of bringing you in outweighs the risk of the exposure that you get in the community or at our facility. So to say, like, yes, we're equipped to take care of you even if it's not COVID, and on the flip of that, we're also preparing to take care of you if it's COVID. That said, I mean, we are a small community hospital, right? So there's some great advantages to that. I think our response to this and setting up a process of preparing, we've been really good and really limber, and I would actually say like ahead of the game in a lot of ways compared to like a really big health organization that just is a much bigger entity to get moving in the right way. So yeah, we're preparing at the same time, and we don't have an ICU. We typically don't take care of people on ventilators in Viroqua, right? If you needed to be on a ventilator in ideal times, we would put you on an ambulance or a helicopter or whatever, and we'd ship you to La Crosse or Madison. And so again, what we're trying to do with our social distancing is make it so that Vernon Memorial doesn't get overwhelmed, make it so that we can take care of you appropriately for COVID, and we are very prepared to do that. We've all been preparing to be able to take care of patients in the hospital with COVID. There's lots of different algorithms and I don't want to say experiments necessarily. There's lots of different ideas out there about medicines and different ways that we should be treating, and we're all very much trying to stay abreast of the best care of COVID patients when they're in the hospital, and different experimental medications and antivirals and processes for what things should happen. So yeah, I mean, we're ready, and we can do it. We'll do the best we can. Yeah.
Just information about, she said about the hotline. Well, I have this information, Vernon County Health Department. The phone number is 608-637-5251. I repeat, 608-637-5251.
So that's the health department, and then we'll have to look because Vernon Memorial has a separate hotline that does go to the nurses at the
Nurse
respiratory clinic.
hotline, 608.
Yeah, that's
Okay, so nurse hotline, Vernon Memorial Hospital, nurse hotline, 608-637-4990. I repeat, 608-637-4990.
That does get answered on the weekends too, and it's a great way if you have these questions and you're wondering, like, I feel sick or I have these symptoms, should I be coming in? Do I need to be tested? What am I supposed to be doing? They're getting super great at helping you navigate that whole process, and so it'd be a good recall.
Okay.
Doctor, I want to connect your response with the next question. I think it's a very common question. Is it possible to detect the disease in a person who does not have symptoms?
Yeah, so that's really kind of cool too, and I was hearing more about that today. So yes, there are antibody tests that exist. They are not currently at our hospital, I will tell you that, but it's even out of stuff that like our lab, I guess, would normally have. So that's a priority issue for us to figure out if and when and how we could foreseeably do that. But yes, and especially like for us as healthcare workers, that could be a game changer in terms of knowing whether or not like if I've already been exposed or already have immunity to the virus, then I am a much much more useful person than somebody who, you know, could maybe be on call for the hospital and then get sick and then I have to be out for 2 weeks. And of course, on a population level too, like being able to test for an antibody and know if you have it without symptoms or if you've already had it and are immune. And yes, all that stuff, I guess, exists and is in the process of being more publicly available. Yeah.
I will encourage the people who is already connected, so please ask the questions. This is our opportunity to clarify our doubts and to have a little more light into this issue. So please feel free to ask questions. It's a question that it's possible that the coronavirus could be transmitted through cigarette smoke.
So it is droplet related, right? Like, so the reason why we wear masks and eye protection and all that is that it's droplet related, so it floats in the air, right? And I guess I would have to assume yes. I have not seen any official, I haven't read anything official on that, but I mean, smoke is in the air and air is in the air, dust particles are in the air, right? So assume that it's transported in the air. Cigarette smoke. I don't think that cigarette smoke is necessarily any more of a vector or risk. I mean, although obviously it's damaging your lungs, and anything we can do at this point to have really healthy hearts and healthy lungs improves our chance of survival with COVID, right? So you probably don't want to be around cigarette smoke, whether it has COVID floating around in it or not.
Doctor, I, for the next question, I read some, maybe not the words jokes, but naturally it's very, very important to keep the spirit in high. Having a good humor, humorize things also, I believe, is important. And in the last day, I was very, it was very funny time reading posts on Facebook for many people saying, yeah, I am an essential worker. I am considered essential worker. Okay, okay. The next question is related with that. How do I know if I am an essential worker during COVID-19 pandemic? How is it possible to know who is an essential worker?
Yeah. Well, so I'm probably totally not the person to ask for that. But I can tell you when I was driving home yesterday and listening to public radio, the recommendations about that came out. Somebody had asked that question to the public radio host and commentator, and they basically said it's like super complicated and it's like a 40-page document, I think, within the state of Wisconsin. So they directed them to a phone number at the Economic Development Center or something like that for the state of Wisconsin and said that you should just call the number. So I have no idea, but it depends on where you work and you need to reach out to the state and figure out. I would guess that 2 days ago you might not have known if you were an essential worker or not, but probably by today you've already figured it out. But as far as healthcare goes, we don't have any say in who's essential or not. That's something that comes from the government.
Doctor, I want to ask for a question for myself.
Yeah.
Regarding that, the same topic. For example, a pastor. If you, for many people, maybe I think that is not an essential work that we develop for our community, but others believe that yes, because we are trying to encourage people, bringing hope. Yeah, I know. Please don't worry. You respond in another way, wherever you prefer to respond. But how I am understanding with my work my ministry to be pastor is an essential work or not. Certainly, I don't know if, for example, I need to attend some emergency that people need to see, is asking for see the pastor. In my interpretation, yes, I am considered myself that my work is essential. But if other is viewing the same thing, maybe say, no, it's real, it's not essential. Essential means other kind of things. What is your interpretation about the pastoral work? Is essential work or maybe so, or I don't know?
Oh, well, in my personal view would be like, yeah, of course it's essential, right? I mean, we're not just physical bodies, we're spiritual beings too, but again, like that definition of essential doesn't come from me. I mean, we can theorize about it and have our own personal opinions about it. And of course, like, you know, if we have a worst case scenario and, you know, our hospitals are overflowing and we're trying to take care of people who are dying, if you want your definition of essential, my guess is that probably somebody's going to want you there, right? So I don't think there's really any doubt that, you know, spiritual care is essential, because of course, you know, more so than other things. If you're going back to the government definition, then you're looking at like people who provide food and infrastructure, and, you know, are there support people for that? Can they, you know, repair your car or make sure that your truck can deliver the groceries or whatever, or take care of your healthcare needs, I guess, right? But I don't know. I mean, it's an interesting question. I don't know what the government said. Did they tell you, are you not essential or are you essential?
In my understanding about the government definitions, in my understanding, we are not essentials. This is my understanding. Yeah. But okay, we are not taking care about the bodies, but the souls. Okay, thank you.
I don't know. That's interesting. I guess we'll have to look at that 40-page document. We should call that number and see what they tell you.
Somebody asking, actually, it's my mom who is asking. Hi, Mom. And she asked why the people who has high pressure or diabetes, they are more at
risk of dying?
Yeah, exactly.
So my understanding is, first off, just to clarify, it's not that you're at risk more to get COVID. You know, it's not more contagious to you, but then the thing is, if you do get it, your heart and lungs and immune system just aren't as prepared to fight it. And what happens with COVID is that you end up, you know, some people get secondary infections, meaning that, you know, you start with a virus and maybe you end up with a bacterial pneumonia. But the other thing that's happening is people's, you know, livers and kidneys are failing and shutting down. So if you have any sort of compromise already and your body is already, you know, not functioning optimally, then it just makes it that process goes downhill. And I don't know that anybody totally understands the why that happens. I mean, there's all these different immune spots, things that happen in our bodies, and then there's all this interesting stuff out there right now about, you know, if you took ibuprofen, are you more at risk of having problems? If you're on something called an ACE inhibitor or an ARB, there might be more risk. So one of the questions with high blood pressure, some of those categories of medicines that we use to treat high blood pressure, it looks like perhaps people on those medicines are having a higher death rate with COVID. But that said, the kind of official thing we've heard from like the Heart Association, I saw something on this today come through my email feed, is that they're not recommending to like pull everybody off of those medications either, at least at this point. So, I mean, could it be the medication that you're on that's making more of a risk? Could it be that your heart isn't functioning as well as somebody else's? There's a lot of different reasons about why you'd be more likely to die.
Okay, so básicamente lo que la doctora está diciendo es que no es precisamente que por tener diabetes o alta presión uno se va a enfermar. en sí, sino que más bien si uno se contagia, corre más riesgo de que, debido a que el cuerpo no está al 100% funcionando, pues corre más riesgo de que se complique la situación.
Y más que eso, hasta el medicamento, que hay algunas clasificaciones de medicamentos que ponen más riesgo.
Do you speak English? It sounds very, very good with a very nice accent.
Oh,
Yeah,
es un acento ecuatoriano.
She speaks Spanish. So thank you. Are there any vaccines or other medical products to prevent COVID?
Not yet. Yeah, no, I mean, I think everybody's frantically trying to make a vaccine, and I think I heard that, there's been some initial trials of that, but I don't have any practical advice to say, like, take this or don't take that. I think the one thing maybe to get out into the world is that ibuprofen thing, right? Which is why you can't find acetaminophen or Tylenol right now on our shelves very well. There's also not thermometers apparently in Uruguay. But ideally, if you think you have COVID, you're going to be better off treating your fever or your body aches with Tylenol, acetaminophen, as opposed to ibuprofen, because there is this thought and I guess some clinical evidence in places like Seattle and California and Seattle, California, China, that ibuprofen has some bad effects with the virus for some people. I think we're still trying to figure out why and how.
Question: how long between? I understand a person who is already contagious, in a period of 10 days, this person could have the symptoms. But how long it takes since is just, this is just a simple flu, it's flu, but how long could we take between the flu and to be confirmed the symptoms for COVID? Do you understand the question?
I think so. Like, at what point does it get really bad? If it's going to be
Yeah,
COVID and not just
I mean,
cold?
for example, it's an example. Today I feel a little headache, and I think I feel with flu, probably could be flu, but it's flu. The 2-3 days is just flu. But how long it could be taken between that flu to is really confirmed, or really starting with the COVID symptoms?
Right. Well, so let me see if I answer it in a way that that makes sense. So I think what you're trying to ask is, like, okay, I got some relatively minor cold symptoms. Is it going to develop into something that I think is COVID? For some people, it never would, right? And you'd never know, was that COVID or was it just the flu, or was it? And right now we're having a lot of overlap, right? Like, flu season isn't over yet, and then we also have the start of allergy season right now. So there's all this gray area of respiratory symptoms. It could still be influenza A, could be COVID. That said, I think part of your question is, what it seems like is you can have these kind of milder symptoms, and then like around a week point, 7 days or so, like some people get really sick at that point. And then the other scary part of that is people go from being like, whatever, this is, just a normal cough or cold or respiratory symptoms, to bam, like needing to be on oxygen or needing to be intubated, within hours. And there's not necessarily a great rhyme or reason to that. They get sick. You can have mild, and they get sick really quickly.
Doctor,
Just if we can talk a little louder, because Ivy said the sound is no good. I'm sorry, Iris, and I'm sorry for everyone. We will try to talk louder.
Sorry, we're far away because we're trying to be 6 feet from each other.
Yeah, I'm from you too.
And then, so it's the distance from each other, and it's how to fit us all in the camera frame in such a way that, sorry, the recording device is far away from my mouth. We need a little microphone right here.
Doctor, my question is different. It's not here. Many of us will love pets.
Yeah.
We love pets. And in fact, in our home, we have one dog and one cat. They are our daughters. And I know that many people have pets in homes. I have two questions. The first, pets are in risk to be to have this kind of COVID-19. And second, pets are what is the word? Okay, in the case that pets are not allowed to contain for that illness can be transmitted to human beings. What are the care that we need to take about our pets?
Yeah, I'm probably not the best authority on this. My initial things that I heard were that pets couldn't get it, although I'll tell you that, I don't know, Greg, if you're watching this, maybe you can type in. A few days ago, he told me, I saw something where maybe a dog or something that had tested positive for COVID. So I don't know. I mean, what I can tell you is COVID is a zoonotic virus, which means that it's a virus that an animal had in China, that the virus was able to transmit from an animal to a human. So, I mean, in the same way, we're saying at this point, I think officially, that it's not transmitting back to animals. So I don't think there's any official recommendations out there. Like, I think you can love on your pets as much as you want, and I don't know that you need to be, scrubbing your hands and trying to keep your dog from getting COVID. But, right, if something can transmit from an animal to a human in the first place, can we transmit it back to them? I mean, you got to think maybe, yeah, right, but apparently that isn't officially happening that I know of, but I'm probably not the best authority on that. We'll have to ask our local vet. I'm not sure. And Greg, if you can type in, if you're listening, you can tell us what you saw, because I don't really know. I know you just kind of anecdotally told me that somebody's dog somewhere has COVID. Not in Baroque.
Doctor, you say something that I am very interested to know. So it's confirmed that the coronavirus was original illness from an animal that was transmitted by human being. Or I read that maybe from some bats, or I don't know what kind of animal, but so it was transmitted originally from an animal to human beings.
Yeah. I don't think anybody knows, like, for sure, and I apologize. Like, yesterday or something, I saw, like, they kind of narrowed it down to, like, 2 different types of animals, that I couldn't tell you now what that was. But yes, it's a zoonotic virus, meaning it came originally from animals.
I'm very interested about that topic because one of my researches is about the care of creation.
Oh, yeah.
The care of creation. And part of my research is not about this topic, but it's a more general topic, about the importance to be care about the environmental for animals, for trees, water, wherever. And we need, the human beings also, we need to try to respect the nature and the creation and trying to not what is more invade environmentals that are not ours. It's more about ethics. Do you have any? I know you have any ideas or any thoughts about that, dear doctor, about our desire for creation, about behavior as human beings, about creation?
Yeah, well, I mean, I guess just anecdotally, what I've seen online over the last week or so is, somewhat of this idea that, this is, I guess, for us, we'd say God's way of forcing us to take better care of our planet, right?
Mm-hmm.
We're not, our carbon footprints are dropping because we're not driving and flying all over the world. We're trying to take better care of each other as humans, but also better care of the world around us. So I guess if just nothing else, I think it's a way to, I hope it helps us wake up to do that. And, whether it's the trees or the animals or our soil or whatever, right? Like, it's a wake up call in many, many ways, to take better care of the things around us,
Mm-hmm.
right?
Robert, Greg Robert, you know him.
Yeah, I know him.
He said he sent us a link about the CDC, talking about the dog that.
Yeah, good thing.
Talking about that. So
maybe it's official. Maybe we can give it back to our dogs. I don't know.
So, but if somebody is interested in this topic, there is the link by Red Roberts about this. And also he said that I wouldn't worry about the dog thing. He said obviously we are receiving information from everywhere. TV, radio, especially social media, about the care we should take, and we should the things we should do to prevent. And for example, when you arrive at your home, is almost to take off all your clothes and before you came into the house, and obviously to wash your hands and everything, but this is necessary to do, to take off your clothes and your shoes before you came into the house, and to clean also the paws of the dogs. It is necessary.
Yeah, good question. I mean, so I can tell you when I go home, I'm in these scrubs because I don't touch my kids when I get home, right? I take off my stuff. I have a official rag that I brought with me here so that I'm wiping everything down that I touch at church because I don't want to contaminate people that are going to be coming into this building. So yeah, I mean, I think your official, you have to wash your hands a lot. I think an average person in the community that if you went outside and you're following the physical distancing recommendations, do I think you need to come in and change your clothes, wipe off your dog's paws? I guess we're not doing that at our house. I'm doing that as a healthcare vector, bringing, I go out into the world, I see and touch a lot more people and things that have a higher chance of, having contact with this virus, right? If you're not somebody who's prone to a lot of anxiety, I mean, feel free, please do the same thing I'm doing, change your shoes, take off your clothes. If you can create a super clean place in your house, by all means, I mean, I don't see why not. But on the same token, if you're somebody who is gonna, develop into OCD tendencies because you're frantically trying to, wipe down every surface, then that's not exactly what I want to promote either. But I know there's good guidelines out there. I don't have anything officially in front of me as to when I was on the CDC website today, there's easy stuff that you can click on and it'll say, tips for at home and whatnot. I mean, I think it's a great idea if you can get out your antibacterial wipes and wipe everything down. Phones are a horrible vector. Hopefully you're the only person that touches your phone, but I think about my phone because I touch it and I'm trying to keep it clean and then wipe it down, and then half the time my kids are picking it up, and so things that we touch a lot, I think it makes a lot of sense just to really try to be careful. There's the 60% alcohol sprays. Those, they function a little bit differently, right? So like there's things like wipes, but then if you're spraying something, you're actually supposed to let that surface dry. You don't wipe it. So you spray your alcohol thing and then it dries for, I think it's 2 minutes. And then your, whatever surface you're spraying is supposed to have the virus killed. So yeah, I mean, I think there's a lot of common sense things we can do, but I think probably the biggest thing is just wash your hands a lot. And I guess the whole touching your face thing, but like I said previously, I'm more of all of that. But yeah. And then I guess, I mean, maybe when you're talking just common sense or final advice things, I mean, if you're, hopefully by this point in all of this process, people are taking this whole idea of social isolation and physical distancing seriously. I'm worried that as we get longer into this, that people are going to start to get more lax and not be as diligent about it. And I've definitely seen, some of our cute little ladies and people that are at risk, if you're over 60 and you have some sort of health condition, and you think that this stuff doesn't apply to you, I think you're nuts. So, I really get worried if people are, whatever, around their grandchildren a lot, and then their grandchildren around other things. Like, I think people get laxed amongst their own families. And that's hard. I guess at one point, my parents were going to come back from Texas, and they were going to be in the apartment that they've been working on over our garage. We were having all these complicated discussions about, like, can we be around them? Can the kids be around them if I'm around the kids? And all this, and a lot of that still, I think, applies not only to my family, but to other families out there. Like, I think we have to take protecting our vulnerable populations really seriously. And then at the same time, I guess I hope my message to people who fit into that category of vulnerable populations, like, please take that seriously. Like, we're doing the best that we can at the hospital to prepare for the worst. But if you're out there running around thinking that this doesn't apply to you, then you're just doing an injustice. So, do your best to take part in trying to follow the rules, so to speak. Yeah.
No, I don't know. We talked about many very important topic. Well, the same topic, but about different ways to see this situation and recommendations and suggestions. Finally, Doctor, I am very interested. Maybe we don't ask it one important question, but you wanted to say something that we don't ask you. Do you have a final, maybe we forget asking you something that maybe is important that you to express? Is also, maybe you can say that in this moment.
Sure. Well, I guess I think let's just try to end on a positive note, right? Like, all the things I think about, I want to say, like, our hospital is preparing really well, and I think that we will do well in responding to however this crisis hits and whenever it hits. And I think there was maybe one question on there about, like, when can we expect, like, the onslaught of this to happen? I mean, every day I think at some point we're going to have our positive, right? Like, all of our surrounding counties are starting to have some positives. So within the next couple weeks, I think we may have it here more, and in our hospitals and whatnot. And if we can keep that to a low roar by doing it. And then I guess, the positives are, in addition to, I think we're preparing well, I guess I like to be an optimist and think, like, even though we don't know when life is going to go back to normal, and I don't know that it will ever look exactly the same, I guess I think we're going to come out the other end. I like to think better for this, right? Like, I think we'll maybe we'll do things differently, like you said, care for our earth differently, care for God's creation differently, care for each other differently. If you're looking for positive things to focus on, I think a lot of people are getting extra time to care for themselves and spend time with their families. And a lot of the things we can do to decrease our risk of, either being affected by the virus or really sick from the virus are things that we should be doing to take care of ourselves anyway, right? So this is a great time to, eat your fruits and vegetables and go out and, get your 30 minutes of good heart pumping, cardiovascular activity a day. Go for that brisk walk outside and, make your heart and lungs as healthy as possible. Our immunity is so tied into sleep, right? So this is a lovely opportunity to try to get your 7 hours of sleep at night and work on your bedtime ritual and just optimize some of those things. Like we've already talked about, it's a great time even though we can't physically always be in the same spot, I think a lot of people are probably going to come out of this with stronger relationships. So it's a great time to work on that, or it's a great time to become a better prayer or a better meditator or whatever. So I think if this allows us all to live healthier, ultimately, then that's a positive, I guess. And that's all stuff that we have well in our control, right? I think a lot of times people get really scared and nervous and anxious about situations that they feel like are out of their control. This is a fabulous example of, feeling like there's all these things that are spinning out of control around us. But if you look at what we can control, there's a lot of that there that I just mentioned that we have a lot of control over, and ultimately is going to make us happier and healthier. So focus on that.
Thank you. So thank you, Elizabeth. Thank you for being here. As I explained you at the beginning, it's a big privilege to have the opportunity to talk with her, and because there is all the work you should be doing now is overwhelming to you, and thank you because you take a space to us. And I know you are a busy woman, not just in your work, also in your home with 4 children and a cat and a dog, and a dragon. So you have a
picture of Gus with the lizard on his head.
Yeah, so thank you.
Yeah,
Really appreciate this. And God bless you. Thank you for all the work you are doing.
Sure.
Now.
Yeah. I guess I'll just say, reach out to me if you didn't get your question answered or something comes up in the coming days. Drop me a line on Facebook or something like that, and I'm happy to do my best to figure it out.
Thank you. Yeah. Thank you. And also, before leave us, I would like to pray for you.
No, thanks.
I will pray for your family and also for Jane. She's a nurse and she's a member of Westview United Methodist Church. So both, they are hard workers, and I talked with Jane yesterday and she told me, yes, we are very tired and we are working extra
She's our
hours.
employee health person,
Yes.
so she's got a lot going on.
So well, praise the Lord for all the work you are really doing, and we know, because we know this will be more a work for you. Well, thank you in advance too. And for those who don't listen to us very well, I'm sorry for that. But also don't worry too much about that, because we already also record this. And Chuck, he will be typing the entire conversation we have. And we will send it to you, to all of you, and a copy by email or regular mail in case you need it, about all the information we received today. So thank you, Chuck, also for doing this, willing to doing this. So thank you for that. Thank you all the people who be together and listening to us. And thank you again.
Yeah, see you virtually Sunday morning.
Yeah, see you Sunday. And let us pray. Let us pray.
Oh, sure.
Heavenly Father, right now we want to say thank you for Elizabeth's life and also for James' life. Thank you because they are now our heroes, and they are now preparing and working a lot to be ready for any kind of emergency. Obviously, our expectation, our hope is that all the work that they are doing now and all the preparation though will be necessary. But Father, thank you because they are ready for any kind of emergency. We pray for them, Elizabeth and Jane, we pray for their families, and we pray also for all the doctors, all the nurses, and all the workers, health workers, and all the people who work in the hospitals around the world. Thank you for their lives, and thank you because you are using them in your hands. Be with us, be with all our friends, our family, and also be with your church. In the name of Jesus Christ we pray. Amen.
Amen.
Amen. And thank you.
Thank you.
Everybody.
Bye.
Bye.
Bye. Thank you. God bless.
Where's
Hey, well, good. I'm glad you guys did that.